This presentation is about ureteroscopy for ureteral and kidney stones and what you need to know to be prepared for surgery. Important anatomy. Stones can form anywhere in the urinary tract. The most common places are the kidney, the ureter, and in the bladder. Ureteroscopy is useful for those stones in the ureter or the kidney. Typical indications for ureteroscopy: a symptomatic stone in the kidney or ureter, stone obstructing the kidney, ureter, or both, or urinary infection caused by a ureteral stone or the obstruction from it. Alternatives to ureteroscopy. Conservative management. This is treatment with medications that may facilitate stone passage and medications for pain. ESWL, or extracorporeal shockwave lithotripsy. This uses shock waves from the outside to break the stone or stones into small pieces that should easily pass. Percutaneous nephrostolithotomy. This procedure looks directly into the kidney through a tube with a telescope to fragment the stone and remove the pieces. This is done through a small incision in the flank. Open or laparoscopic stone surgery. This is rarely done. Decision for ureteroscopy. Your physician will discuss the alternatives with you. However, if the decision is made, it is based on several variables, including the location of the stone, the size of the stone, the density of the stone on imaging, otherwise known as stone hardness, the size of the patient, availability of resources, and the type and severity of symptoms. What are the risks of ureteroscopy? This procedure is very safe and there is no incision. The common risks include infection, bleeding, injury to the bladder, ureter, or prostate in men, possible ureteral stricture, recurrent stone formation, inability to remove the stone, need to place a stent, and need for additional medical or surgical management. What does the procedure entail? The patient is brought into the procedure room and placed on the table. Anesthesia will be administered. The patient is placed in the lithotomy position, which is similar to a gynecologic exam. The urethra, which is the urine tube, is gently cleaned. A long, thin scope, the ureteroscope, is inserted into the urethra and up into the ureter. The stone then can be removed with basketing or fragmented with a laser. Usually, X-rays, known as fluoroscopy, will be used to identify the stone and help guide the treatment. This is a depiction of various forms of ureteroscopy, both rigid and flexible. Ureteroscopic treatments. Laser fragmentation of a stone involves a small laser fiber that can break the stone into very small fragments that will easily pass. Stone basketing involves trapping the stone in a specialized basket and removing it from the ureter. Sometimes these are combined in the same procedure. Ureteral and kidney stones. Typically these are not smooth. They are commonly jagged and may irritate the lining of the urinary tract. Sometimes a stent, a small tube in the ureter, may need to be placed to keep swelling from blocking the ureter. Stones will be sent for analysis to aid in developing a program to prevent further stone formation. Double J stents. Often you may need a double J stent after ureteroscopy. They can be irritating. They may make you feel that you have to urinate very frequently. You may have pain in the kidney and at the end of urination. You may require medications to help with spasm. Your physician may need to remove the stent with a cystoscope, or sometimes there will be a string which you can remove on your own. What to expect after the procedure? What to expect after the procedure? Usually you will see blood in the urine, which may last for several days to weeks. Drink plenty of fluids to help flush out the blood. You may have mild burning with urination that usually lasts several days. Usually Tylenol will help with this. You will be given narcotic pain medications for severe pain. Many times you can return to work several days after the procedure. You may have a ureteral stent. The stent will stay in for several days to weeks depending on your situation. You may need a cystoscopy to remove the stent. After the procedure, you will wake up in the recovery room. You may feel like you need to urinate or have a bowel movement, or even both. You will be given prescriptions that include antibiotics, pain medications, medications for stent pain, which may include pyridium, Urabel, or others up to your physician's discretion. You will have instructions as to when you should follow up. When to call your doctor. If you have a fever greater than 101.5, chills, severe pain unresponsive to the medications given, constipation despite stool softeners, or nausea or vomiting. How long will it take? The procedure itself takes approximately 60 to 90 minutes on average, but every case is different. Plan to arrive at least 60 minutes prior to your procedure. You will often go home the same day, and you will need someone to accompany you and stay with you. How do I schedule the procedure? A surgical scheduler will give you a date. Usually this date will be within 2 to 3 weeks, as we need to obtain pre-authorization from your insurance company. Pre-authorization. The pre-authorization process is essential. We will communicate with your insurance to determine your coverage and any co-payments or deductibles that you may owe. We will provide you with an estimate of any charges that you may incur. All charges are due prior to the procedure. Payment plans can be arranged as well. In some instances, your physician may send other tests at the time of your ureteroscopy. These include stone analysis, which may be performed if a specimen is obtained to determine the type of stone for further prevention or treatment, or a urine for culture. If the urine is cloudy, this may help your physician treat with correct antibiotics. These tests will usually be covered by insurance, but may not be included in your estimate. Urinary stone disease. As you are a stone former, you are at risk for making more stones. You should discuss with your urologist additional workup and therapies to prevent further stone formation. All stone formers are encouraged to drink large amounts of fluids. Should you have any questions regarding your procedure or recovery, please contact your urologist office.